So could you talk a little bit about the role of scientific uncertainty in response to emerging infectious diseases?
Yeah, Sandra, you and I have actually both faced this, as infectious diseases physicians and those particularly working in infection control. I think that what we need to sort of think about in terms of information sharing, particularly about emerging infectious diseases outbreaks, is that as we learn about novel pathogens, the knowledge base increases as we respond to an outbreak. And our response to the SARS-CoV-2 infections as well as COVID-19 pandemic are a perfect example of that. Often what you see is that the first 100 patients increase our knowledge about both the disease as well as how to both better take care of them and how we can improve and refine public health policy around it. But that very sort of distinction, right, that building of scientific consensus over time, which is built on existing knowledge about viruses and bacteria, but then can sort of alter, as an outbreak goes on, sometimes leads to difficulties in communicating to the public, particularly as recommendations need to be changed as there is, evolving evidence. The other parts that make it difficult is that with novel pathogens, we often, have to wait until we have diagnostics that can tell us how big a problem is, until we can have therapeutics and vaccines that are evolving and we're sort of assessing both their efficacy and their safety. And so just even the response and the shape of the response changes over the arc of a pandemic. And so there's inherent things, in some ways, there are integral things to sort of responding to novel pathogens that are similar to every other health emergency. When things are fast moving, it's hard to get information out in an equitable way, in a way that sort of doesn't feed into confusion, that doesn't leave space open for malicious intent potentially to spread disinformation. But novel pathogens in particular are difficult because there is that inherent difference in terms of gathering data as we respond to them.